Cardiac screening offers an opportunity to pick up heart disease or identify risk factors for the development of heart disease before they lead to symptoms that may cause the patient to present. Importantly, this offers an opportunity to treat conditions at the earliest opportunity or to modify risk factors that can reduce the likelihood of developing disease at a future point. Cardiac screening, importantly, should involve a discussion with someone such as myself, who will take a history, both of your medical history and particularly any family history of relevant diseases. But then we will usually augment that assessment with a variety of tests. Now, exactly which tests we use will depend in part on what we are screening for, as I will discuss later on. But often we will do some routine blood tests, which may include things like your cholesterol and markers of blood sugar control, as well as sometimes kidney function. Again, we may add additional tests depending what we're testing for. Quite often we will do an ECG to get an electrical tracing of the heart, which can show up certain abnormalities, but may be normal despite the presence of disease that you're not aware of. So we will often go on to do specific tests that interrogate the condition or risk factors we're looking for. Often these will be imaging of the heart to identify whether your heart's function is normal, both in terms of the pumping function itself, but also the valve function. Or we may do more specific tests such as cardiac MRI to look for any scar of the heart that identifies disease that has occurred that you may not be aware of, or can examine the blood supply to the heart through either stress perfusion tests by MRI or echocardiography, or to look directly at the heart arteries with, for example, a CT coronary angiogram. So again, we have a whole raft of tests we can use for screening, and the ones I've just discussed are by no means all of the ones we may recommend, but they will depend exactly what we're screening for. Another thing that we may discuss and offer you is genetic testing. So testing for changes in some of our known genes that either cause or have the potential to cause heart disease or risk factors for heart disease. Now, this may not be appropriate for every individual, and indeed for some conditions, the genetics of those conditions are not well understood, such that it would be unwise to offer you genetic testing, or such tests don't exist. But for many of the conditions I see, we do have genetic tests that may be useful, but it's important to apply those correctly, and I would discuss that with you before we undertake those. Cardiac screening can detect a wide variety of heart and vascular conditions, and indeed we may choose a specific area to look into for you rather than necessarily look at all the possible things cardiac screening can look at. So for some people this might be an understanding of their risk factors for developing heart disease or cardiovascular disease such as heart attack and stroke, and we would look at things like your cholesterol, your blood pressure, your blood sugar, your exercise, your lifestyle. Alternatively, for other people, it may be trying to understand a family history of heart muscle disease and identify whether you are affected by that or whether you are at increased risk of being affected by that. Or it may be an assessment for previous damage to the heart that is silent, or an assessment of the heart function or heart valves to see whether there's any change in those that hasn't led to the presentation of symptoms, but may be valuable to identify to either monitor or treat early. So really, there's a huge breadth of things we can screen for, but we would often focus on what is most relevant to you. So really, cardiac screening is appropriate for anyone who is concerned that they may have heart disease or risk factors for heart disease. Clearly, if you have symptoms, then we should investigate those symptoms and may not label it as cardiac screening. But if you have a family history, particularly of heart attacks or strokes at an early age, or you have a family history of relatives with heart muscle disease, for example, dilated cardiomyopathy, where the heart has become enlarged and weakened, or hypertrophic cardiomyopathy, where the heart has become thickened, then it is very important that you are screened, because actually disease can affect different family members in different ways. And it will be very reassuring to know that you have normal heart function and no evidence of that disease. Similarly, if we're looking at your risk factors for heart artery disease, we have an opportunity to improve those. So screening with normal outcomes is obviously perhaps desirable for everyone, but equally identifying an abnormality that you were not aware of gives us an important opportunity to treat that if needed, or to do other things that might be important to maintain your safety. So one could argue that everyone should have some form of screening, because I think it's important for all of us to be mindful of our risk factors for heart artery disease, even from an early age. But there are many individuals who have a very strong family history, particularly of heart artery disease or of heart muscle disease, that they may merit screening being done perhaps earlier than is often otherwise done. Again, there are a variety of other conditions that one can look for example, congenital heart disease and other very specific conditions that we don't have time to discuss in detail now, but I'd be very happy to discuss with you if that's relevant to you. Another group of people who it's important to undergo cardiac screening are people who've had often sudden or unexpected death of a relative from a cardiac condition, particularly at an early age. Then we can also obviously screen for a variety of abnormalities of heart rhythm. Essentially, if you think you would like to discuss screening, please do get in touch and I'll be delighted to discuss things with you further.